A review of the UK's response to the PIP Breast Implant Scandal has concluded that serious lessons should be learnt from the affair. The study by the Health Minister Lord Howe found that the regulator, the MHRA, had acted appropriately and followed clinical advice, but it said both the regulator and the Department of Health should improve their communication with patients. Our medical correspondent Fergus Walsh has more details.
Communication, that's the serious area that needs further work here for the regulator, the health regulator, the MHRA. And this review by the Health Minister Lord Howe says if it looked back 2 years ago when PIP implants were banned, when it was found that they had an unauthorised filler, that the MHRA could have done a lot more then to reassure women in the knowledge that were more than 40,000 of them that had these implants, and there was this great sense of unease and anxiety that was obviously going to be there. Were they in any way posing a cancer risk? Now, further tests found out that they did not, but it said that it could have helped prevent misinformation and misunderstanding if it had been more proactive, and could even have used social networking like Facebook to have helped reassure women there. The other thing is that it says that monitoring of products should be done better, that there have been concerns from surgeons dating back several years with these PIP implants. It says the MHRA needs to improve its systems there and indeed across Europe to help protect patients better.
Well, for more on this now, we're joined by Kevin Timms. He's one of the solicitors representing up to 2,000 patients in a group action lawsuit against clinics that provided PIP implants. Thanks for coming in, Kevin. Just to start with, we should just make sure, as I was saying there, the legal action is against clinics that you're representing these women for, not the health service or the manufacturers. Do some of those clinics exist still?
No, a lot of the clinics unfortunately have either gone into liquidation or many years ago became dissolved. One of the things that we're doing is trying to establish whether there was adequate insurance in place, and if the clinic has been dissolved previously, we'll restore that clinic to the register of companies.
And so this report by Lord Howe is probably the first full bit of advice and insight into what happened that some of your clients have ever had.
I think actually what's come out in the press is probably more useful to the clients in terms of understanding what the problems are with the unauthorised and industrial grade silicone. In terms of actually understanding what the MHRA have done since 2001, it's been helpful in that respect, although it hasn't highlighted some of the major issues that the MHRA could have dealt with. For example, in 2010, testing the physical and mechanical properties of the implants themselves. So
you don't agree with the conclusion that they acted appropriately and did inform the client?
I think it was appropriate for them to do the toxicology test in 2010 before the French. That was very helpful, but considering we, at the time, knew there was 40,000 women in this country that had PIP breast implants, in contrast with France that only had 30,000 women, more should have been done to find out exactly what was wrong with the implants and how the MHRA and the government could help the women concerned.
But it was relaying information, it was communication that seems to have been Lord Howe's concern, and I remember probably some of your clients interviewing them when the story first started to emerge, and some of them were really scared, really worried about their future, didn't know what to do, didn't know who to turn to, and certainly weren't getting any information.
Certainly, I mean, in terms of what the NHS has been doing, it's a lot more fluid now, but in 2010, women didn't even know they had PIP breast implants apart from a few. When it came out in December 2011, the NHS was slow to inform women. The MHRA could have done much more in 2010 to make surgeons tell women that they had PIP breast implants and to have an ultrasound or MRI scan to see whether or not they had any problems.
Do you think there are lots of other lessons to be learned, as Lord Howe has suggested in his report, principally regulation?
I think one of the problems with the regulatory regime in place in Europe at the moment is that medical devices such as the scandal with the metal hip implants that we deal with also, and also the PIP breast implants, is that if there's a product already in the market, another product could be brought to market as long as it's similar to that existing product. Now, there doesn't need to be any clinical trials there, which frankly could lead to another disaster as the PIP breast implants in 5 years' time. There's nothing in place to stop that.
So this could happen again?
It looks like it, until we know that there's going to be processes in place to ensure that each new medical device brought to market is adequately tested and that consumers are going to be adequately protected, even if there is no clinical trials, then I see no reason why this shouldn't happen again.
Well, that's a worrying thought to end on. Kevin Timms, thank you.